What a terrific conversation with Theodore. He'll be joining us later for a table talk. I encourage people to spend time with him. He's got a lot of insight, not just into the science, but into what it takes to make it a reality. And when I first heard Theodore talk and I started learning about what he was doing, part of me thought, well, is this too technical for a kind of group like we have here assembled in our summit community? And then it occurred to me we all have an obligation to know about things like CRISPR and gene editing. Just like today we know about HbA1c and talk about it, whether we're payers or providers or innovators or financiers or regulators. We're increasingly talking about monoclonal antibodies. We're learning about epidemiology, those of us who didn't already know it, as we go through this pandemic. And we certainly think about the cost of specialty pharmaceuticals and everything that it takes to get them to somebody's door or to their bedside or in their physician's office affordably. And if we don't understand the underlying science and what the potential is and what we're able to do, we look like those kind of distant, removed healthcare executives who aren't really empathizing with consumers and embracing their truth, embracing what they're trying to get done, and serving as a community that actually supports them because we understand what's possible. I'm also struck by Theodore's analogy of, are we building the Segway or are we building the Dreamliner? And I think that extends to a lot of what we do in healthcare. We have literally dozens of healthcare startups here today. We have even more innovative operations inside of big incumbents here today. And most of those, the truth is, will not succeed. They will fail. And one of the reasons they will fail is that they're building Segways. Segway is designed for a segment that we think we understand because it looks like us. It's designed to be gold-plated. It's designed to presumably reinvent transportation. But we don't think about how it fits into the system. We don't think about how it connects with people. We don't think about all of the issues surrounding it and the kind of community we need to make it a reality and hold ourselves accountable to those market realities. The Dreamliner had a bumpy start too, by the way. We shouldn't just deem failure at the beginning to mean we're on a path to building a Segway. In fact, the Dreamliner took longer than Boeing thought to produce. As some of you may remember, that it actually had battery issues with its lithium-ion batteries at the beginning. But they kept relentlessly responding to the demands of the market and to what their customers want, to the point where they've now produced more than 900. And so when we ask that question that we all ask in meetings about new initiatives, will it scale? How many times have people asked that? Will it scale? Think. Does it have the hallmarks of a Segway, or does it have the hallmarks of a Dreamliner? And what are we going to do to make it have the hallmarks of a Dreamliner? One of those things that we get questions about most, at least, as we have conversations throughout the industry, is artificial intelligence. We all heard last year from Sean Lane at Olive AI, who told us that artificial intelligence wasn't about replacing humans with robots. It was about taking the robot out of the human. But it's even more than that as AI evolves. Rana Calibi has spent most of her career thinking about AI from a very different perspective. She grew up in Egypt. She moved to the US. She wrote a terrific book, Girl Decoded. I have a paper copy, an old-fashioned hardcover copy of it here. Everybody after the summit will get a code for an electronic copy of the book. And she calls it A Scientist's Quest to Reclaim Our Humanity by Bringing Emotional Intelligence to Technology. What does that mean? What Rana says, and what Rana will share with us, is that the power of AI is that it can actually make us more human. That the truth of AI is that we will have done it well when it makes us more human. As the CEO of Affectiva, she has spent a lot of time trying to develop the kinds of technology and processes to make that happen. Please join me in welcoming Rana Calibi.
Hi, everybody. And thank you, Sam, for the wonderful introduction. I like the take the robot out of the human. Love that. That was really awesome. So I'm Rana Calibi. I'm Affectiva's co-founder and CEO. And as Sam said, author of Girl Decoded. If you do end up reading the book or listening to it, there's an audio version that I narrate. Please reach back out and share what resonated with you. So I've been on a mission to humanize technology for the last 20 plus years. It all started all the way back when I grew up in Cairo, Egypt. And I grew up with a family of technologists. Both my parents, they actually met at a Cobot programming class many years ago. And so I grew up surrounded by the latest and greatest technologies. And what always struck me was how technology could change the way people connect and communicate with one another. And that's been a common thread of my work over the years. And then I had the opportunity to go to Cambridge University and do a PhD in computer vision and machine learning. And when I got there, I realized that the technologies that we deal with, this was over 20 years ago, were completely and still are completely oblivious to our emotional and mental state. And that not only affects the human-machine interactions and all the potential that technology can bring in terms of persuading us to change our behaviors or motivating us to be healthier and more productive people, but it also affects our human-to-human connections and communications. And it's kind of ironic and somewhat sad that we live in this world right now where a lot of our vast majority of our connections and communications is virtual, and that's especially true today with this event, but also in healthcare, and hospitals have been kind of forced to accelerate their adoption of telehealth. There's a lot of advantages to that, of course, but it's not the same as an in-person connection or in-person communication. And we're in the business of trying to quantify the vast majority of nonverbal signals, which is the majority of how we communicate. Over 90% of how we communicate is nonverbal. It's split between your facial expressions, your vocal intonations, your gestures, your physiology, and only 10% is in the actual choice of words we use. And so, with our devices today, most of our devices are completely oblivious to that channel of information, and we're trying to bring a data-driven and a machine-driven approach to it. So at a high level, my mission is to marry or bring to AI not just IQ, cognitive intelligence, but also emotional intelligence. And I fundamentally believe that that's going to reimagine human-machine interfaces, but perhaps more importantly, human-to-human connections. And then I mean, there's a lot of applications of this technology, everything from, market research and getting insights into how people emotionally engage with content around them and products and services. Especially with the pandemic, a lot of the work that's being done around focus groups, that's all migrated online, and we're able to quantify people's emotional engagement and levels of attention. To automotive, we're doing a lot of work in the automotive industry where we're tracking, the driver's state of attention, engagement, distraction, drowsiness, but also expanding that to other occupants in the vehicle to personalize and, again, reimagine what a mobility experience looks like. But for today's conversation, I really want to focus it on the applications of AI, and in particular, emotion AI in healthcare, and how that's going to change the face of health tech. And I try to organize it into 5 different trends. So the first trend is around bringing emotion AI to healthcare, to specifically mental health. So if you think about it, when you walk into a doctor's office, they don't ask you, what is your temperature or what's your blood pressure? They just measure it. We have objective sensors that we use to quantify these very important vital signs. But when it comes to health, the gold standard is still, on a scale from 1 to 10, how stressed are you? How anxious are you? How depressed are you? How suicidal are you? It's still very subjective, and we know that there are real downsides to relying on just this data. And I feel strongly that we can do a lot better. We can bring objective, data-driven approaches to quantifying mental health. We already know that there are facial and vocal biomarkers of stress and anxiety and depression. And if we are able, Sam talked about the importance of scale. So the underlying technology, the underlying, if you like, AI classifiers or machine learning algorithms, they're there. We are able to capture all of these nuanced facial expressions that can be indicators of mental health disease like depression. But the key question is, how do we bring these algorithms to bear in a very scalable way? And one idea is, of course, to integrate it with platforms, with technology platforms that we use every day in, day out. Things like, our social media platforms, our conversational devices like Amazon Alexa. Now, all of these devices can really establish a baseline of how we feel and our facial and vocal inclinations. And then if you deviate from that baseline, it can flag that to a clinician or a family member and hopefully get you just-in-time support and just-in-time help. So there's vast applications in that space. Of course, there are major privacy considerations. At Affectiva, we have a very strong set of core values where we do not take on any industry or application where consent isn't explicit. So we're really kind of real sticklers for privacy. And I think a lot of these applications, especially around mental health and especially around how we deploy these AI systems at scale, we're going to have to think very carefully around privacy considerations. Who owns the data? Who has rights to that data? What does this data look like? And what permission, do the data owners have? And how much autonomy do they have around this data? That's going to be a key consideration as we design these systems. Now, one of the very first applications that I explored with this technology back at MIT before we started Affectiva was in autism. So individuals on the autism spectrum really struggle with quantifying people's emotional and social signals. In fact, they find the entire kind of even face so overwhelming that they avoid it altogether and often won't even look a person in the face or look the person in the eye, missing out on this 90% of our nonverbal communication, right? So what we developed at MIT was a pair of glasses with a little camera embedded. That was back in 2005. When cameras were not as ubiquitous as they are today. So we actually had to source a tiny camera, a spy camera from the internet to embed that in a pair of glasses. And the kid was able, if we had a child on the autism spectrum, child was able to wear the glasses and it was connected to a Bluetooth headset where it gave the child real-time feedback around the facial expressions of the people they're interacting with. And we gamified it so that if the more face contact you made, the more kind of brownie points you got. And we were able to show that this real-time feedback for children was very effective in helping them capture and understand these nonverbal signals. Fast forward, 10 or so years, we are now partnered with a company called Brain Power. They use Google Glass and our technology to bring the same idea to market. The technology is currently deployed in around 400 houses. And I would love to show you a video. So if we can play the autism video.
8-year-old Matthew Krieger has been diagnosed with autism.
A lot of the trouble he gets into with other kids is he thinks he's funny and doesn't read at all that he's not, or that they're annoyed or angry.
Matthew's mother, Laura, signed him up for a clinical trial being conducted by Ned Sahin.
I want to know what's going on inside the brain of someone with autism. And it turns out parents want to know that too.
You get points for looking for a while, and then even for looking away and then looking back.
Sahin's company Brain Power uses Affectiva's software in programs Matthew sees through Google Glass. These games are trying to help him understand how facial expressions correspond to emotions and learn social cues.
One of the key life skills is understanding the emotions of others, and another is looking in their direction when they're speaking.
Looking at your mom, and while it's green, you're getting points. When it starts to get orange and red, you'll slow down with the points.
Am I looking at you?
You are looking at me. Are you looking at me? Do you think you are? Yes.
Well, I don't know if I am.
You don't know?
Because I found out that if I look this way, it doesn't count. But if I look at the screen at you, I can still see your eyes, and it gives me points.
So, but if you tilt your head up and look under the screen, you feel like you are looking at me?
No,
What's
I
the
feel
difference?
like I am both.
Just a few minutes later, the difference in Matthew's gaze overwhelmed his mother.
I'm gonna cry.
Why?
When you look at me, it makes me think we haven't really before, because you're looking at me differently.
The brain learns very well by feedback. We don't know for sure yet, but we're going to find out if the kind of feedback we're giving can help people teach themselves these skills.
Thank you. So we know from the research that BrainPower is doing that they've deployed, about 400 or so Google Glasses around various homes in the United States. And we're finding that the kids are definitely improving while wearing the glasses. As you saw with Matthew, the key question is whether this generalizes when you take off the glasses, right? Are they learning skills that generalize beyond this tool? So is this tool an assistive tool, or is it a prosthetic? And kind of, we're still figuring that out. But a huge potential opportunity for the technology there. We also have a partnership with a team at Stanford that is looking into Parkinson's. They've already found initial facial biomarkers for Parkinson's disease, and they're looking into early diagnosis of Parkinson's and being able to intervene early and track progress as well. So the idea there is, again, the first trend is, can we quantify mental health disease and other disorders using these facial and vocal biomarkers and data that is readily accessible given the amount of time we are spending in front of a machine? Trend number 2 is around telehealth and telemedicine and being able to quantify empathy and tie that to patient outcomes. So it turns out this was work that was done by Professor Karl Marcy many years ago at the Harvard Medical School. He showed that doctors who are more empathetic were less likely to get sued in the event that they made a mistake. So that's really critical, right? The perception of empathy by the patient is really critical, and it also led to improved patient outcomes if the doctor was perceived to be more empathetic. So fast forward to today, and a lot of care is being done virtually. We have an opportunity to quantify empathy in a way we have not done before. So if you're able to track, a doctor's nonverbal signals and a patient's nonverbal signals, and you kind of superimpose them on top of each other, and you look at the dynamics, right? If the patient looks worried, does the doctor respond with concern and with empathy or not? And if we're able to track these signals in a way we've never been able to do before, you can imagine, and of course tied to patient outcomes, you can imagine how that can be really transformative in terms of quantifying some of these signals and then using it to coach doctors in terms of how to be more empathetic. So there's a lot of interest there. We have an initial pilot with Children's Hospital in Boston looking into ways we could do that. Again, given that a lot of their, they've kind of pivoted to accelerating their deployment of telehealth platforms. So that's kind of an area that we're very interested in. But you could also imagine how you could augment, again, using kind of quantifiable facial and vocal biomarkers of stress and anxiety. You can quantify or augment the telehealth session by some of these biomarkers, given that, again, the doctor is unable to measure these in a quantifiable, objective way. Trend number 3 is around cobots in healthcare. So a cobot is a collaborative robot. It is not a robot that wants to take over. It's not a robot that is designed to take the human's job, but it's designed to collaborate with a human or a team of humans. And I think we're going to start seeing a lot more of these nurse avatars and social robots at home or in healthcare contexts that provide care. And one particular example, which I find fascinating, is around this robot that gets sent home with terminally ill patients. And the idea is that the robot is a conduit for, you can't send a clinician or you can't send a nurse with every patient, but the robot is a proxy for that nurse. So it's meant to take care of the patient, monitor the patient's baseline. Again, if they sense that the patient's not sticking to their medication or that they're depressed, it's going to flag that to an actual nurse and bring in actual human support. The way I like to think about it is like every nurse now has an opportunity to 10x, to multiply the number of patients they care for, because they can send out these robots who can monitor the patients and then only call on them if it needs to escalate. So we're seeing kind of a deployment of that. And I'd like to show another video of a company we collaborate with, Telehealth. They are an MIT spinout, and their robot is called Mabu.
How are you doing? Want to try a breathing exercise together?
Sounds good.
This is Mabu, a companion robot that looks after patients at home.
She's here to remind us mainly about our medications.
It's a face you may want to remember, because Mabu, or something like it, might look after you one day.
I realize she's a robot, but in a way, like, you actually feel that she cares, like she said, I'll call your doctor, and that's like something that a friend would do for you.
As we live longer and our aging population strains the healthcare system, AI and robotics may fill the gaps.
We don't have enough people to provide the level of care that we'd like to. And so that's really where robotics and AI come in.
But are we ready to hand over life and death decisions to the machines?
Usually take your next dose at 2 p.m.
Let's start with Mabu from Telehealth. Okay, so it's cute, if a little bit unsettling. But what can it do? Well, it can't change the sheets or give you a bath. But thanks to innovations in AI, it can monitor your health, send encrypted data to your doctor, and even read the emotions on your face. But as personal healthcare bots become more advanced, will they take over for human caregivers?
It's really not about replacing those people, but augmenting them so that ultimately they can do a better job at managing a large number of patients.
That's helpful.
Corey Kidd's been working on healthcare robots for more than a decade. Mabu is his latest.
Thank you very much.
This robot is not making a diagnosis, it's not recommending treatment. That's still something that the doctor is doing. Once the patient has that diagnosis and has been given a treatment, this device is helping patients stick with that.
Exactly. So once again, the idea is not to replace the human doctor, the human clinician or nurse, but it is to augment their ability to take care of patients, especially at home, and especially when there's longitudinal kind of care needed. So that's something we're very excited about, and we think of ourselves as the emotion brain for Mabu, to create this kind of personal connection that can be quite powerful. I mean, we know from years of research that people who have emotional intelligence tend to be more persuasive, and I believe that that's true for technology as well, especially technology that's so deeply ingrained in our personal and professional lives. Building on that, the fourth kind of trend is around being more human in terms of the health tech apps that we are seeing around us. So it doesn't have to be embodied as a robot. It could be an avatar. It could be even a chatbot. But all of these devices need to have some kind of contextual understanding of the person's emotional and mental state so that it's able to maximize and contextualize and personalize the feedback it's giving you. We have a number of we had a makeathon over the summer where we had teams of young people, including high school students, kind of craft and reimagine what an interface could look like that can help with mental health. One team came up with an idea of a smart mirror that could have these same sensors integrated in them, like a microphone, maybe a camera sensor, very much like, how your TV would have, what your TV would have, or what your phone has. But this smart mirror can have a conversation with you, and based on your facial feedback, it can flag if there's something wrong, and it can say, you've been really down the last 5 days. I think you need to take a break today. Take some time out of your day and go out for a walk, or meditate, or watch something fun. So it can monitor you. So I guess the form can take. It can look like a conversational bot. It can look like a robot. It can look like a mirror. It could be integrated even maybe into your fridge, right? Like keep thinking about a smart fridge that, looks after you and helps you eat healthier, but also recognizes if you're stressed and you're going to binge eat ice cream for the next few hours, and it's going to stop you from doing that, right? We also know there was this really key piece of research that was done at USC where they had PTSD patients divided into two groups. One group conversed with a human therapist, and the other group interacted with a socially and emotionally intelligent virtual therapist, an avatar, sensei. And they found that the patients that interacted with the avatar were more forthcoming because they saw that this avatar was not going to be as judgmental as the human was. And that says a lot. I mean, it says a lot about the technology, but honestly, it says a lot about us as a humanity. And it begs these really interesting questions in the future. If you're interacting with a virtual therapist, do we need to know if a human is at the other side of it or if it's an AI, and what kind of moral and ethical implications come with that? And again, who has access to all of these conversations and data? I mean, there's a lot of human-centric design considerations that we have to think about. It's not just about the technology. In fact, the technology is easy to build. It's more about, how do we take a human-centered approach to building these things and think through all of the unintended consequences? Which brings me to the fifth trend of humanizing AI in health tech, and it's around mitigating bias by bringing diversity and inclusion to how we design these systems. And that's really important. We all know that we each have our own blind spots and our own prior experiences that we bring to bear when we are trying to solve a problem. So the more diverse voices you have around the table, the less likely the solution is going to be biased, and the more likely it is to work for all of us. In my particular field, this manifests in terms of bias in the algorithms. So if we are building, facial expression classifiers or emotion classifiers, if we train it on a particular set of people, maybe, a white male data set, it's not going to generalize on people who look like me. So it's so important that the data is diverse in terms of gender, ethnicity, age, even people with mustaches or who wear the hijab or glasses or eyeglasses. So all of that becomes really important. And the only way to do that is to bring diverse team members around the table to design and deploy these AI technologies in a way that is ethical. So to wrap up, I shared with you some ideas around how humanizing AI will help. And I encourage you to put the human first. Thank you. Thank you.
Rana Calibi cares for our heart. We can't neglect our patients' feelings from the start. AI can help us do things better for sure, but healing our emotions are all part of the cure. We're moving from Cobots to virtual therapists. We're quantifying empathy as humans really do exist. We realize emotions are the fourth vital sign, but will we get it together or go out of our minds? These are future truths, and just like Mabu, we mustn't lose our way, 'cause AI is here to stay. Emotions stay their day. AI is here today. I'm with you, Rana, yeah. Let's play the faces game.